एवरीवन, दिस इज डॉक्टर सागरिका एंड आज का लाइव हम सबको पता है बहुत इंटरेस्टिंग होने वाला है विद द सेम क्वेश्चंस जो आपके दिमाग में थे रिगार्डिंग द लीच डॉक्टर एंड फर्दर लीच कहाँ कहाँ प्रैक्टिस हो रही है, किस बेसिस पे क्या हो रहा है। जो क्वेश्चंस आपके दिमाग में होते थे सेम मेरे दिमाग में होते थे एंड आज हम उन पे लाइव डिस्कस करेंगे विद द लाइव डॉक्टर। तो लेट मी फर्स्ट सेंड रिक्वेस्ट। आप प्लीज अपने अपने क्वेश्चंस के साथ रेडी रहना। सो तो जितने वैद्यास आ रहे हैं प्लीज अपने क्वेश्चंस रेडी रखना रिगार्डिंग द लीच डॉक्टर, है ना। इंट्रोडक्शन मैं पहले दूंगी, जो क्वेश्चंस हमारे कुछ क्वेश्चंस थे वो इंट्रोडक्शन में ही क्लियर हो जाएंगे, है ना। कहाँ कहाँ से ज्वाइन कर रहे हैं मुझे प्लीज ये भी बताते रहना साथ साथ। Oh, doctor here. Hi,
Oh,
doctor.
good morning. I didn't realize that I couldn't do it from the desktop. I can only do it from my phone.
Yeah. The scenery
Anyway.
is good, by the way. View is good.
Yeah, no.
In your background. I like the background, by the way. Yeah, it was nice. Yeah. So let me start this live. You are in your clinic, right?
It's an office. Yeah, it's
Yeah.
an
Okay.
office. Yeah.
Okay.
Uh-huh.
So let's start the live. I will start the
Yeah.
live from little introduction of yours. So hello everyone. This is Dr. Sagrika, and we are live with the least doctor, Dr. Entry. So let me introduce first. So he is a dedicated person with a background that bridge clinical practice, research, and healthcare leadership. Dr. Henry brings a well-rounded perspective to modern medicine, combining Western and ancient medical knowledge to well-rounded integrated practice. With each subspecialty that he practices, he has a very personal relationship both as a practitioner and as well as patient. By the way, I have seen the history, so much appreciated it was. So background is in dance, and after that he pursued a career in physical medicine and rehabilitation, making him an expert in musculoskeletal interventional medicine, as well as traumatic brain injury, spinal cord injury, and stroke rehabilitation. Chronic back pain because of a dance injury led him to pursue a path in pain and interventional spine medicine. So, yeah, doc, it was very good.
Too many
Yeah.
things. Too many words about a very simple doctor. I'm a simple guy who is here to talk about whatever we want to talk about.
So it was very, new thing, seeing, watching you doing lease therapy in USA. So that's why I was very interested in, to doing live. Okay, how you are practicing, what you are practicing. So let's start this live with a question. My first question is, that doctor, what made you choose lease therapy in an era dominated by advanced microsurgery and pharmaceutical?
It's a question that I can answer either by a short answer or I can actually talk about it for a
It's totally your
long
choice.
time. But the reality of things, how did I come across it? I was faced with a medical issue myself, to which medicine in the United States does not have very good answers. So, believe it or not, leech therapy is practiced in Russia. That's where I'm from. I'm practicing in the United States. I am in Los Angeles right now. And I called my mother and I said, "Mother, I have a problem." And she says, "Don't worry about it. Just do this. Do some leeches." My mother is not a medical doctor. I said, "Mother, you're crazy." But often I do not take my mother's advice. But somehow this time I took my mother's advice and I looked into it. I was taking 4 medications, maybe 5 medications. My body was in kind of in ruins. And then I found a way to purchase some leeches in the United States with almost no knowledge on how to use it clinically. I learned the best I can, and I started practicing this on myself. After 7 months of work, I got off all the medications. I'm perfectly, I'm not perfectly healthy. I'm 51 years old, but I'm reasonably in good shape. So I created leeches to my own health benefit. Now, right after that time, I was kind of impressed, so I decided to do more research. And believe it or not, in Russia, therapy or leech medicine or whatever you want to call it is very, very popular. It is part of mainstream medicine, and therefore I called up a couple of schools. There are two schools of leech medicine. One is in Moscow, one is in St. Petersburg. But I actually chose a third school, which is out of Barnaul, which is much closer to India, believe it or not, Altai region, where I took maybe 250 hours of schooling. And from then on, I started implementing the practice here in the United States. That's a short version.
Okay. So the main excitement was how people react when you'll tell them that you should go for leech therapy or this treatment is included leech. How people react there?
So we're very lucky because we live in Los Angeles, and people in Los Angeles come from all over parts of the world. So this is not America per se. And in Los
Appreciate it.
Angeles, we have a lot of people from former Soviet Union. We have a lot of people from Turkey. We have a lot of people from India. We have a lot of people from South America. In certain parts of the world, leech therapy is accepted.
Yeah.
Obviously, in India, it is a big part of Ayurvedic tradition, Ayurvedic medicine. So people know about it. Some parts of the world, people are aware of it, and they know that it can be useful. I'll give you an example. I had a patient who came from Turkey, and she had a chronic infection of the breast.
Yeah, yeah, I've
And
seen that reel as well.
you
Yeah,
know,
I've seen.
the woman, her choice was to do surgery, essentially cut the breast off. What was a mastectomy. That's what they offered to her in the United States. She called her mother in Turkey, in Turkey, and the mother said, "No, no, 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 no! Don't be stupid. Do some leeches." Because she could not travel back to Turkey because of immigration status. So she found me. So most of my customers, they either know about it, or they have heard about it, or they've heard it from the parents, or they've heard it from somebody who benefited from it. Now let's shift back to like a mainstream America. When I talk to mainstream American people, they look at me like I'm crazy. Okay, because in the United States, if you want to degrade medicine, if you want to degrade something, and you say, "Oh my God, this is
Ridiculous.
useless knowledge," they actually use a phrase. It's like a snake oil. Well, probably you and I know that snake oil has a lot of medicinal benefit. Okay, but the people in the United States use that phrase to describe something which has absolutely no use, and it's so rudimental and so degrading. They also use phrase leech medicine, which is basically means that it doesn't work. There is absolutely no way it can potentially work. So when you have these two phrases built into the language, and you try to explain to somebody what this is, of course you have people thinking that you're mad. You're a doctor who has gone completely mad, and I am a Western medical doctor who has a MD after my name. Now, if I was a naturopathic doctor, if I was practicing Ayurvedic medicine, if I was practicing some kind of a naturopathic medicine or chiropractic or anything like that, people would react very, very differently because the clients who come and seek the
They are
help of
used to of
individuals
that medicines or
are
you know.
very, very different. They're open-minded. They're
Yeah.
open-minded. They know that we are being treated by plants, by food, by animals. It's a biologic medicine. In hospitals, we're using maggots. We're using
Yeah,
leeches.
maggots therapy. Yeah.
Yeah. Bee bites, and yes, venom of the snake, we use it, right? So in medicine. But people who come to seek my help expect pharmaceuticals, surgical intervention, and that's it. So when I start talking about it, it does not, it does not add up. It's a big problem for me. Big problem for me.
Doc, somebody is asking, should we test HIV and hepatitis test before applying leash to the patient to prevent spreading of infection?
Again, these are great questions.
Yeah.
By the way, most of my most of the audience on my social media is from India, believe it or not. In the United States, we practice it very differently.
Yeah.
Okay,
Yeah.
in the United States, I'm bound by the guidelines of a Food and Drug Administration. So, in the United States, I cannot reuse the leaf. I can only use it once.
Yeah, same here. Yeah, same here. Same here as well. We in India also do the same, that we only use one lease to a patient, and we made a box with his or her name, and we'll separate both the boxes and all the boxes of the patient with their
I
name.
cannot even do that.
Mm.
By it's not law, it's not legal, but the best practice is for me to actually euthanize the leaching alcohol. The moment I take it off, I have to mix it with alcohol and discard it. Unfortunately, this is what I have to do by the book. Now, I used to let them go into the pond. I used to let them go into the river. I hope the United States government is not listening to this, because they will say you're not doing the right thing. But unfortunately, in the United States, I have to discard the leash. So even if the patient is infected with HIV, even if the patient is infected with hepatitis, even if they have a bloodborne disease, they will never be able to spread it because I have to kill the leash.
Oh.
So it's a good. Yeah, I have to kill the leash in the United States.
So there is a practice difference. So basically, what I do in my personal practice, I take their weight before applying. After that, I'll take weight after they suck the blood, and we'll give them turmeric. So what they do is to vomit what they have been sucked. So they used to do vomit, and then we'll take weight again,
Yeah,
and then we'll give a gap of 7 days for them
yeah.
to, yeah.
Most of the comments I get, what are you doing? Why are you putting alcohol? No, you have to put turmeric. You have to do this. You have to do that.
Yeah, I
Look,
see in comment section. Yeah, I see in
I
here.
know. I know it works. And I know that from a turmeric and the leech, you will never get superimposed infection. I know that. I also do not put leeches on people who are immunocompromised and who cannot fight infection. But unfortunately, because I'm bound by very strict guidelines of the United States medical practice,
Yeah, that's what I was also saying because of the
I
guidelines.
cannot use turmeric. I do it on myself, but I cannot do this on the patients who I treat. Why? Turmeric is not sterile. I cannot use sterile turmeric because it doesn't exist. It's a powder. And because it's not sterile, I cannot put it on the wound. You and I both know that you will never get infection after a leech bite. If you treat it with turmeric, you will never get infection unless you're terribly immunocompromised. And if you are, you shouldn't be using this therapy in the first place, right? But the United States government and the medical practice in the United States imposes rules on me. If I have a cut on the skin and I put something non-sterile there, I completely violated my diligence on how to practice Western medicine.
Mm.
So for those listeners and people who are watching me, please forgive me, because what I'm showing in my videos is not that something has been done for thousands of years and people haven't had problems. But because the United States medicine functions in this way, I have to practice. I'll tell you how it's bizarre. We sterilize skin with alcohol swabs.
So yeah, basically it is because of the guidelines and belief
Yes.
as well. We believe in turmeric because we studied it like that. and you started it in very different form. That's why we are doing live. I just
Yes.
want to know what you are doing and what I am doing.
Yeah. I have to do the wrong thing. It's not a wrong thing, but I have to do it differently because of where I'm practicing.
Yeah,
You
yeah,
know,
it depends on
we
location
are
also.
engaged in stupid practice. We put alcohol on the skin before we do injection.
Hmm.
Does alcohol sterilize the skin? Absolutely not.
No, no, no.
Absolutely not.
Yes.
But we do it because the government tells me to do so.
Hmm. Agree.
No, I
Uh,
would rather put turmeric. Yes, and I
yeah.
would rather keep the leech alive.
Someone is asking, please ask, is it work for cancer patient? Are you practicing Leech? Of course, yeah, I've seen. Miss Mamta Arora, you can watch the Leech Doc page and you'll get this information. He's doing huge diseases, I guess, cancer as well. So,
Look, it's a complicated question. Uh, I cannot cure cancer or promise anybody that somebody's cancer is going to go away. But in my opinion, leech medicine can be used for a lot of cancer conditions to either eliminate pain. It can boost immune response. It can treat wounds. It can treat. It can be used as a palliative care. So you can use it in cancer patients. Now we have to be specific. What cancer for what purpose? Are we talking about blood cancer? Are we talking about bone cancer? Are we talking about brain cancer? But yes, in general, there is use for therapy in cancer as long as the person understands that the leech therapy is not going to cure cancer. If you're going to cure cancer, your own body is going to take care of it. Your immune system is going to take care of it, not the leech.
yeah.
Now, in the United States, I cannot do it. Why? Imagine me, I have a license of medical doctor. What is it? Medical doctor. And now I'm using leech therapy for your cancer. They're going to sue me. I can't. They're
Yeah.
going to
You
tell me I'm
can't.
crazy
Mm.
because the society in the United States not only does not accept it, it doesn't understand it. It has no idea how amazing the therapy is, what it is that we're using. They have absolutely no knowledge of it.
Right now you are also facing, I guess, these type of things, or a competition kind of thing with other doctors, because you are doing something very different. Is any, like, you want to share, or because you are doing wonder in so much of diseases, so I guess doctors mainly are jealous of it, for sure.
Well, you would think so. I thought I thought it will be the way, but it isn't. In the United States, I'm the only licensed medical practitioner
Mm.
who has a practice like this. This is not all I do. This is part of what I do.
Share
I'm
in India is
where
totally different.
yeah,
Other practitioners used to troll, Ayurved doctors who are doing leech. So that's why
yeah,
I
yeah.
was in
In India, it is completely different. I
very
have
different.
hundreds of comments from all kinds of people from India.
I know.
Some of them are good comments. Some of them are terrible comments. You stole Ayurvedic medicine. You're a fraud. You're doing this. You're doing that. I said, look. I'm just doing what I know how to do.
Yeah, I also got your reels from my junior by saying, these kind of words. But because I have read that guidelines, which you are also talking about, so you are allowed to do so. You are doing. That's nothing wrong in that.
I know. I
Yeah.
know. You cannot cut
So
a leaf. It's like saying, it's like me, going to be me saying to you, you cannot use aspirin. Why not? You know,
it's typical to, okay. So my second question is, how accepted is medicinal lease therapy among surgeons and hospital in USA? As I asked. before
So
as well.
in the United States, there is a Food and Drug Administration that supervises the practice of medicine. Uh, the Leech is cleared by the Food and Drug Administration of the United States as a medical biological instrument for one purpose and one purpose only. It is the plastic surgery application to reattach uh, human tissue to the other part of the human tissue to reestablish the circulation. So it is used in hospitals by plastic surgeons who have special training in it. The widespread of this is not very it's not very widespread. I'll tell you, per year, only 200,000 bleaches are used in the entire United States by every practitioner who buys them from one source. So if I would have to guess, a hospital may use maybe 10 leeches a month, maybe 20 leeches a month, depending if they do trauma surgery, if they do a lot of plastic surgery, if they do a lot of interventions like that. Uh, Besides the physical intervention and reestablishing the circulation in the blood, medical practitioners do not know anything about the benefits of leech
Yeah,
therapy.
because they haven't studied, of course, how they
Yeah.
know. Yeah.
So it is one of the best kept secrets in the United States. Among medical providers, it is clearly completely unknown, and that's why the beauty of it, you can do anything with it, and when you see good results, people are very amazed. But also, when you start talking about it, people look at you like you are a madman. I just gave a lecture. I gave a lecture to a bunch of regenerative medicine doctors. They use stem cells, and
But now you got so many testimonials, so now it is not that difficult to, understand the leech therapy, I guess, around.
believe it or not, we even established American Hirurotherapy Society. By the way, anybody is welcome to go American Hirurotherapy. Actually, sorry, the website is hirurotherapysociety.org, where we compounded hundreds of thousands of scientific papers from around the world, from Russia, from India, from China, from Turkey, from the United States. It is the largest source of scientific information, of hardcore science, which backs the principles of therapy. So
Yeah,
it is
yesterday also
available.
I got a comment from, I guess, Bali. He was also a practitioner doing leech in Bali, Indonesia. So
Hmm.
I requested him to came on live as well. I also know how they are practicing leech therapy in Bali, Indonesia.
Yeah,
We'll
yeah.
do eventually. We have to do this together, I guess.
I would love to. The interesting thing, because in India, this is a part of Ayurvedic tradition, right?
Yeah, yeah.
So there is a school, there are procedures, there are guidelines, there are, it is formalized. If they do have Ayurvedic school in the United States, they mention nothing about the leech. Nothing. Not a single word. My first student in the United States is a student of Ayurvedic medicine school, and she never even got exposure to that.
Yeah,
I'll give you an
that's right.
example. In Indonesia, there is no school. They use it, but they use it only. It's more of a like traditional folk medicine. People just say how to do it. People in Turkey, they do the same thing. They just use the leech because somebody's mother, somebody's father, grandfather, grandmother taught them how to do it. But there is no school.
No,
Uh,
there is a huge medical colleges who are organizing BMS as a degree where we learn leech therapy in our colleges as well.
in
So it's
your
a
Yes,
yeah,
absolutely. In India, yeah, but
yeah.
not in places like Turkey. At least I'm not aware. Or people use it in Southeast Asia, Thailand as well. Believe it or not, uh, ancient traditional Chinese medicine including therapy, Leech medicine. But current traditional Chinese medicine doctors do not know anything about it because that was before traditional Chinese medicine, ancient tradition. So that has
When
been.
you studied leech therapy, so what you have studied in the history or the past where leech therapy came? Like, this is quite
Well,
excited.
it's. I think it's as old as humanity. The first mention of leech as an animal to be used in medicine is actually, to the best of my knowledge, is in Great Pyramids of Giza in Egypt. The history states that Cleopatra could not get pregnant unless she was treated by the leech. So Cleopatra got pregnant because of the leech treatment, and uh, that's why there are use of the medicinal leech in the pyramid in the ancient Egypt.
It's
My
totally different what we
Yeah,
have studied here.
really. My understanding is then imagine the geography, imagine the map of the world. So and again, what happened before that we don't know. But the first mention of the medicinal leech is there. Then after that, it became part of the traditional Arabic medicine. Later on, the tradition moved east. It moved toward Greater Ottoman Empire. It moved next to the from there it went to India, to China.
Have you
Then,
heard about Acharya Shushruta? I just want to know that.
yeah, then it actually went up geographically to the southern parts of Russia, and of course in India it became an Ayurvedic medicine, big part of Ayurvedic medicine. In China, that practice has been forgotten and completely erased from medical books. But in places like Thailand, who did not keep the good record in the books, but person to person, they know that it has been used in Southeast Asia as well. Then now it goes up to Russia. In Russia, they kept the school because they saw the usage of it. So the only place where leech medicine truly exists is the Ayurvedic medicine, and the modern school of that is in Russia. And to the best of my knowledge, nobody else has a school of it. Tell me how people teach you.
Sorry?
Please tell me what how is it different from what you are taught?
I have studied it in Ayurveda, of course, and so we have Sanhitas. Like
Of
we
course,
have, yeah, Sanhitas. So we have studied leech therapy in Shushruta Sanhita. So in our world or in our India, what we have studied that Acharya Shushrut has introduced leech therapy.
uh-huh,
So
uh-huh.
it came in blood-letting therapy, which is
Right.
called as Rakt Mokshan in
Yes.
Ayurveda. So
Yeah.
Rakt
Yeah.
is blood and Mokshan is letting, so blood
Mhm,
letting. So
mhm.
that's what Leech as well is doing.
Yeah. Uh, Believe it or not, it is still believed in the United States and in most of the world that all leech does is just sucks the blood. It just let the blood. Nobody knows that the leech has saliva, and
Yeah,
the use of the
yeah.
leech is in
Eroding.
saliva.
Yeah, yeah.
Yeah. There's about 400 proteins in that saliva,
That's
and
what
only
I am also fighting because people didn't know. They don't know history. They don't know anything about leech therapy, but they just want to know how to troll in India. So I
yeah.
usually fight with the trollers for leech, and we have Agni Karma. We have so many things for what we are fighting in India.
Wow. 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 Wow.
So yeah, my next question is, what are the common condition where you routinely using leech therapy?
Okay. So I try to approach it from a point of view, again, where I practice. If I was not in the United States, I would be using leech therapy very, very differently. But where I practice in the United States, probably my number one target for leech therapy is going to be arthritis,
Yeah, yeah. Your first
osteoarthritis.
video as well. Yeah, your first reel is
Osteoarthritis,
on arthritis, I guess.
yeah, because most of the Western scientific literature, again, it has nothing to do with the reality. but I have to practice by some kind of a guidelines. And if people are asking me, I have to show them something, you see. So therefore, most of the scientific literature written in the West or accessible to Western people here is literature on osteoarthritis. So that's where I start. Now, I use therapy for other conditions. A lot of musculoskeletal pain, arthritic pain, chronic tendon pain, chronic joint pain, neck, back. Then I love treating internal medicine problems, intra-abdominal problems. We know that the saliva of the leech is almost like a bioscalpel. Without opening the body, I can deliver the medication and lyse adhesions within the body. I can use it to treat the liver, which has a lot of scarring from cirrhosis. I can treat gallbladder to try to loosen up some of the ducts and to get rid of some stones. I can get rid of some intra-abdominal scarrings after surgical C-sections.
Yeah, I
Uh,
seen that one.
in the United States, cosmetics is the only other place. It was popularized by Demi Moore in Hollywood, and there is a nurse that used to practice in Los Angeles. You can do a lot of cosmetic things, like I clearly don't use it myself, but you can do almost like a facelift with it. I have a child who I'm treating scars. Scar treatment works beautifully. A lot of the things that we should.
So basically, you are
Uh,
doing for pain management, right? So here in India, we used to do leech therapy in skin disorders, blood disorders, wound
yes.
healing as well, and
Yes.
pain management for sure.
Yes, yeah. Wound healing, bone healing. We know that
Wound.
if you apply
It's the
leech,
best thing to do in wound healing for sure.
yeah, you know that if you apply leech, you number one, even if you have a broken bone, the bone is gonna heal much faster, at least 12 days faster than it would heal. 12 days. It's 2 weeks. For a lot of skin conditions. I've seen amazing videos from India where people come in with skin conditions. One of the things that I hope to treat and get a lot of customers is erectile dysfunction in men. Okay, because we being prescribed Viagra, we being prescribed all these pills, and they intermittently open up the blood vessels, but then they close back. With the therapy, I can open them up and keep them open. I can
Yes.
stimulate the sacral plexus and reinnervate the organ. But people are so afraid. They're like, "Oh my God, I'm going to put leeches on my penis. I'm not
I
going
is
to."
gonna shock. Lately, I have applied leech therapy in alopecia, and I'm getting very
Yes,
best results
yes, 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 yes.
because of the blood
Alopecia. Yes,
circulation, because
exactly.
of the the wound leech create and
Yes,
regeneration of cells. So
yes,
we are
yeah.
getting result in alopecia as well.
Revascularization of the scalp. You just have to have the hair follicles have to be still present. There is a type of alopecia when the hair follicles are completely gone. It's not going to work. But if they're still present,
Of course.
yes,
So we should
absolutely,
have taken a history before that,
yeah,
patient
absolutely.
history for that. Yeah.
There is a huge use in gynecological disease. There's a huge use in infertility treatment. And if you're in Russia, I've studied that you actually apply leeches intravaginally through the speculum.
Oh,
But
this is
yes, and
something
what you can
exciting.
do, fallopian tubes sometimes they get scarred from the
Yeah.
from the disease.
Hmm.
What leech can do, leech can open up those scars so the egg can fertilize, the
Yeah,
sperm can
so yeah,
fertilize the egg.
because we are doing this for blood circulation there.
Yes,
So there are huge patients of fallopian tube blockage as well. So I also
yes.
want to try after this. I also want to try that in blockage of fallopian tube for sure.
Yeah, and by the way, you can use it even without doing it intravaginally. But
Yeah,
the
that's
easier way to deliver the medication is also going to do that. But again, because we're in the United States, imagine a guy puts leeches for a woman in a private space. I'm going to get sued. I will lose my medical license in 1 second. I cannot do that because the mentality of people
it's
in this
quite difficult
country.
though. It's quite difficult as
Yeah.
well. So
Listen, it's not that difficult, but again, it's just the mentality of the United States and the mentality of the law professionals in the United States. If I catch you the wrong way, you're going to sue me because
so
everybody wants to sue the doctors.
do you have any or you have studied any rule, like if leech, you are applying leech and leech is not sucking the blood, that means there is purified blood present, so we are not use leech therapy in that place. Is Have you studied this kind of thing in your practice or your school?
Again, um, I would have to talk to you more about this concept. Um, my understanding is that it's quite up. My understanding is that there is no return blood coming from the leech. You should use it in that spot again because that means that there is no circulation. And it depends where you put the leech. It depends what part of the body. It also depends on what you're trying to accomplish. But when you do have a poor return of blood, that means two things. Either the leech itself is not working, because sometimes you get a leech, an animal does not want to suck. If the weather is bad, the leech is not going to work. If the animal itself is not healthy, it's not going to work. If the
So
animal
what
is,
you do after that? If leech is not working or not sucking the blood, what you do? If you are applying leech and leech is not working, then what you do after that?
I change the leech, number one. I change the leech because sometimes I have to bring the patient back again because the whole batch of leeches that I buy, the source of leeches in the United States is terrible. It's completely is non-existent. So we are actually trying to organize our own farm, and we're looking for investors to help us to organize and to grow the leech in the United States. There's nobody growing the leech. So the leeches that I buy, they have to be delivered in a box in a container, and sometimes they go to put them in the airplane. Sometimes they're sitting in a place where it's too hot.
Yes.
The leech, when it arrives, it's in terrible shape. So uh, sometimes I may have to bring a completely entire new batch of leashes. Number one. Number two, the leash is not working because people may have lotion. People may have perfume. Maybe the weather is bad. Maybe the skin is too cold. Uh, Sometimes I would have to break the skin with a needle to let some blood out. Then the leash is going to attach.
Ah, yeah, yeah. To attract them. Yeah. We
Yeah.
also do the
Uh,
same.
but there are places on the body, let's say if I'm trying to treat somebody's arthritis of the small joints don't work for arthritis. Big joints do. But sometimes I would put a leech somewhere, maybe on the face, and the leech does not work. It's probably my mistake because I did not make the skin warm enough. So I try to rewarm the skin. I try to bring some blood to the surface of the skin because leech can actually sense the proximity of the blood. Um, and sometimes you will notice a wound or a place in the leg when there is no blood supply,
They easily suck. Yeah, yeah, yeah.
and you will know
So there
exactly
is
what.
a difference. Have you seen in your practice that if there is impure blood? Sorry, I got the call. So,
Uh-huh.
have you seen in your practice that if there is impure blood, leech is very easily sucking the blood, and if you are applying leeches in arthritis or the location which are hard to where we applying the leech, have you seen the difference?
I'm not sure what the
For
question
an
is.
example, if we are applying leech on wound, right? So wound is the area of impure blood, or leech. When we apply leech on a wound, so it easily suck the blood, right? So we don't need to struggle for that. But if you are applying leech for arthritis on knee, that is quite difficult. Or you can take eczema versus arthritis. If somebody is having eczema or cirrhosis, so leech will easily suck the blood without any struggle. But in arthritis or joint related issues or pain related issues where we are applying, that is quite difficult. Have you seen this in your practice?
Absolutely, absolutely. Look, I look at it a little bit differently. I look at condition of the skin. The first of all, I look at the person. Are they do they even have blood in them? Because you will see people who are like this, they're very thin. There's not much circulation. They don't have the chi. The energy is not flowing. The blood flowing. They're just utilizing the blood which is in the big vessels. Because the leech works with the peripheral blood. If we have 5 liters of blood in us for a man, 2 liters is circulating actively. 2 liters of blood is sitting in the organs, sitting in the surface. It's not in active circulation. So my assessment first, how much of circulation can I possibly achieve in the periphery? Some people, I know that they will have plenty. They will have a venous stasis. They will have a good blood perfusion. And sometimes I will look at the person, I'll look at their limb, and I'll know that there is not going to be much return from that limb because there is no circulation, because there is no supply, there is no venous stasis, there is no blood. So I look at it more of, I know that in Ayurvedic school is very, very different. Even the language that we use is different. But I have not studied the way you studied, so it's difficult for me to answer. So sometimes we do have a bit of a language difference in how we talk about it.
So,
But
but
my
we have
understanding,
seen this in our practice, right? That's the
absolutely.
main
Oh yeah,
point. So,
of
Ayurveda is
course.
explaining this in a very good form, though. At that ancient wisdom, the thousand of year ago, if somebody explained the fact that if you are applying these therapy in the area where impure blood is present, then leech will suck blood very easily, and you have to use that leech in that particular area only. So I guess that is appreciated of Acharya Shishvit for sure.
Yeah, again, see, we have to discard the leash, number one. So number two, uh, my take on it is slightly different, but I would love to talk to you more about the impure blood
For
concept or
sure.
something.
Now we
Yeah,
are connected. We
yeah.
used to, uh, uh, we'll discuss our patient on daily basis. I would love to, like,
Oh yeah.
if I'm doing right now, I have also told that I'm doing lease therapy in alopecia. That is quite a different thing I'm doing.
Mhm.
So
Yeah,
this is the main collaboration which I want from you
yeah.
as
No,
well.
no, no, for sure, 100%. I'll tell you what I know. I'll tell you what I've seen. I'll tell you what I've
What you
done. I'll tell you
practice,
the
yeah,
experience.
what the
Absolutely.
results are, yeah.
Yeah, yeah, yeah,
Yeah.
yeah, 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 yeah,
So
yeah.
in Ayurveda defined use of different type of leeches as a line of treatment in different type of diseases. That is a very deep study. Like which leech you have to use in which diseases. That is very deep study.
Well, yes, I am aware of the concept, but again, in the United States, we only use 3 species.
Hmm.
We use Hiruda medicinalis, we use Hiruda orientalis, and we use Hiruda of medicinalis officinalis. These are the species which have the saliva that has been studied. Most of the disease, most of the leech, if I only had one leech to pick, I would pick medicinalis, Hirudo medicinalis. I know that I can use that leech pretty much for anything and everything. In India, you're lucky because you have access to leech. In
Yeah,
the
in our
United
textbook,
States,
there are 12 type of leeches, and
yeah,
there is a leech called very Sariva. So it's a common name, so I remembered. So we use that leech in animals also. That is written in our textbook that that leech is of 18 angul, so measurement, and
wow,
we use it for animals only. So
wow,
Ayurveda describe it in that form, 12 type of leeches.
wow, 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 wow. Yeah, all I know here, all I know, see, I have access, I don't have any access to anything. I don't have access to leeches. In the United States, we buy leeches from suppliers. Um, In most of it is in either Turkey, Indonesia, possibly Azerbaijan, and we rely on those sources. These leeches are brought to the country and they resold on a black market. Believe it or not, it's a black market mostly, with an exception of one company. Only one company buys the leeches from a farm in France. It is the oldest farm in the world that produces medicinal leeches, and they produce either Ferula medicinalis, Ferula, or verbena. So verbena is the other, or verbena, verbena, depending on you ask. It
In
is.
India, it's easily available. There are huge vendors we
Oh
can
my
get
God.
it from.
Oh my God. Yeah, yeah. We have to talk about your supplier because look, we are starting a leech farm right here across the street, and we need a supply of leeches. And in the United States, I cannot buy leeches unless they were raised in a farm. And if they are raised in a farm, the leech gets inbred. It's the same leech. There is no genetic variability. So the animal itself loses its potency. The saliva loses its potency. So here I'm so limited on what I can use.
But this is
Sometimes
good
I
for
want to.
patient safety and social well-being as well. This is a good step of your government to, just record and just getting the details. That is quite good or really very different thing from India.
Yeah, yeah, yeah. So we please hook us up with your supplier.
So yeah, so coming to an end, my last question is, what message would you give to young doctors? Because there are huge doctors who are watching our live. They all are BMS doctors and my juniors, my seniors, my colleagues. So, what message would you give to young doctors about keeping an open mind towards evidence-based traditional therapies, like leech therapy?
Look, in this particular case, we are talking about a medical practice that can be used in 90% of human disease. 90%. I'm not talking about curing 90% of the diseases, but I'm talking about helping. I'm talking about an animal which has at least 40 medicines in its saliva, 400 proteins in its saliva. Name me one medication that has that much use. None. Name me one medication which is being developed which has so many medicinal properties in it. None. Name me one intervention in medicine that can be used so versatile for so many different things. None.
Without complication. There is none.
Without any complication.
It is
So,
already written.
yes,
We are aware of it, but still we
yes,
are choosing that path.
because
So
we are, at least in the United States, we're brainwashed by the pharmaceuticals, by the businesses,
pharma mafia.
by the mafia that we have to take these pills, and because it's called modern medicine, that it is the only way to go. I I resent it. I fight it because we have something which is free. Well, it is not free. You still have to buy the leash, but it used to be free, and it can be used for just about 90% of human pathology. How can you possibly discard such an amazing intervention? And thank God in India, you understand, people appreciative and but in the United States, I'm lost. I'm lost at the stupidity, the narrow mindedness, even the language of the medical practice. I am, it's a big disappointment for me. So for the young people watching us, please don't think because it's 2,500 years old that it lost its value. No, this is the reason why it has the value because it hasn't changed. It worked 3,000 years ago. It works the same way now. Why reinvent the wheel?
100%.
Why reinvent anything? We have it, but
So
it's
you
our
also believe
modern.
that nature help us in healing. This is nature.
Absolutely. Absolutely. Yeah. 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 And we as a modern society, we discard it. We think it's ancient, old, outlived. Uh, and in English language in the United States, there's a derogatory word. It's tragic, So, but it's those people who are swimming against the stream. We're going to make a difference.
Yeah.
An eagle. How does eagle fly? Eagle doesn't just flap its wings. It goes against the wind and it lets the wind take. So the truth is the wind. The real medicine will always remain on top, regardless of how many people try to put it down, degrade it, diminish it. Because the fact remains the fact that it is one of the most amazing versatile tools in a medical box. So study it, use it.
In last, I just want to know because I am excited to know that do you trust Ayurveda as in medicine? Have you tried any Ayurveda medicine? Because I think you believe in nature healing. So have you tried any Ayurvedic medicines in your practice or for yourself as well?
Yes. So my first student was an
Yeah,
Ayurvedic.
you were telling that.
Okay.
Yeah.
So of course I came to Ayurveda after I discovered the Leech medicine. So uh, my own student opened the eyes for me on the ancient school of medicine. So obviously I developed some interest. Obviously I my student gave me treatments. My own mother, when she comes to visit me here, she goes to the Ayurvedic medicine doctor. So yes, the answer is yes, absolutely.
So it was nice talking to you, and thanks for giving us time for the live because I know it's your clinic time or office time, and patient
Sunday.
of
It's
course
it's a
visit.
day off. It's a day off. I hope you're not working. You are working today though. This is
No,
Monday.
so you have day off. Wow, wow, wow.
Yeah.
But we are, yeah, in India that is also quite difficult or very struggling path as a practitioner here.
Yeah.
So, the Liz Doc and the Dr. Indio, I would request or I would like to request that will came another live on the patient or on diseases. I will
Sure. Absolutely.
discuss
Absolutely.
on that basis as well because
That'd be
people,
incredible help.
what we are doing here is to aware,
Yeah.
social public about the leaf
Absolutely.
therapy, and we both have the same motive. So I would request that will come another live on a particular
Absolutely.
diseases with
Absolutely.
patients.
I would love to. I would love to. We can even
Yeah,
bring patients. We can talk about it. Absolutely.
yeah. Thank
Thank
you
you
so
so.
much, Doc.
Thank you. Thank you very
Thank you,
very much.
doctor.
Thank you for.
Okay, okay. I'm ending this. Bye, bye, everyone. Thanks for watching
Thank you
us.
for watching.